So you have some concerns about your skin?
Uh-huh.
So tell me about them.
Well, I used to have really bad acne, so just keeping the scarring down and that sort of thing.
So are you still breaking out?
Minimally.
Okay, but nothing like before?
Mm-mm.
Did you have cystic acne before, the big cysts?
Yes.
Okay. And what finally made that go away?
Accutane.
Okay. And when did you last use Accutane?
August of 2 years ago.
Okay. So because you need to be, we like you to be off Accutane at least a year
Yes.
before doing laser treatments. And since then you haven't seen a lot come back?
No, this past, I would say 6 months has been more than anything, and it's just been really minimal.
Okay. Great. Have you done anything for your acne scarring?
No.
No. Okay.
Yeah.
Great. Well, let me take a quick look. Is there an area that you've noticed more than others?
On the sides, definitely.
Yeah, I see some over here.
Yeah.
And then some
And
right through
then
here.
about right here.
Yeah. And then it looks like you do have some small pustules. What are you using on your skin right now for your acne?
I use Cetaphil.
Okay. And does that work for you?
Yeah, I've used it for years. I just haven't really, I haven't really explored any other options.
Okay.
Because I don't really know what to look for as far as.
Okay. So as far as the acne goes, just because you don't want to get back into where it was really bad,
Right.
things that you can add into, add to your Cetaphil. So Cetaphil is not hurting your skin, but it's not doing a lot to help your skin either.
Mm-hmm.
What you do is you want to have something that has cell turnover. So somewhere along the way you probably use Retin-A. So being on a Retin-A again. Now, that doesn't mean it has to be really strong and doesn't mean you have to use it every day. If Retin-A made you really red, you could use a retinol instead.
Mm-hmm.
And what it is retinol is the precursor to Retin-A. So it kind of turns into Retin-A in your
Okay.
skin. So that's something. The other thing is to be on something that has glycolics and salicylics.
Okay.
So salicylics help dry up the bacteria that causes acne, and then glycolics are going to help with cell turnover.
Okay.
So stuff like that to add into what you're doing.
Okay.
And then what do you use? Do you use Cetaphil cream as well?
Yeah, I use the SPF 15.
Okay, so then something you might want to consider, just because you look, at least up here you're looking a little bit greasy,
Uh-huh.
is maybe a gel moisturizer
Okay.
instead, and then a powder sunblock.
Okay.
So those kinds of things will keep you from getting too clogged.
Okay.
Okay. Now, as far as your scarring, different ways to approach it. Okay, so you can either approach your scarring as aggressive, where you go in and you sort of do a big overall aggressive treatment, and that's not what we're talking about for today.
Yeah.
But an overall aggressive treatment where you're going to go in and you're going to basically make tiny little holes, what's called a fractionated laser. We make tiny little holes in the skin, and then you heal from the inside out.
Okay.
But with that, you do have 10 days of a bright red, peely face, downtime oozing, and probably a lot for the fact that you actually have some light scarring.
Yeah.
You have some scarring, but nothing that you see you walk in the door and it's the first thing you notice.
Right.
Probably compared to when you had acne, you'd walk in the door and be like, oh, I don't want anybody to see my
Right.
face. So another option is something called laser genesis.
Okay.
So laser genesis, some people call it a laser facial. The reason they call it that is because you have a nice glow afterwards.
Oh.
What it does is it targets the second layer of the skin. So if you think of the skin as 3 main layers, there's more than that, but 3 main layers.
Uh-huh.
It targets that second layer of skin and it stimulates collagen there. And so slowly over time, you make your own collagen and fill in those holes.
Okay.
Now, with that being said, it's not going to go away completely, but
Right.
it would improve.
Right.
When you do the treatment, it feels like you're laying in a tanning bed. Not that we advocate going tanning, but it feels like you're laying in a tanning bed. It's got that warm heat. Laser makes, I always laugh because it makes a kind of like funny ding, ding, ding noise. I don't know why. Something to do with Vegas,
Yeah.
probably. But, kind of makes a little noise and it counts. And then we sort of target the areas, we do your entire face, but then target the areas where you have the scarring.
Okay.
It's a series of treatments, so we recommend 5 to 10 treatments, and then from there see how you're stimulating collagen. And you won't necessarily notice results right away. You'll notice your skin's glowing, but you won't notice them right away. But over time, your body's going to stimulate collagen.
Okay.
So what kind of questions do you have about it?
I think you answered them.
Okay.
Really-
I go through all the questions people have already asked me
Yeah.
before and try to cover them.
Well, yeah,
So-
that makes sense because I
Good.
think everything's covered.
And the treatment takes about a half hour, 45 minutes.
Okay.
Not even really that long necessarily if we're targeting, but let's say, up to a half hour.
Okay. And no downtime?
No
Just-
downtime. You'll be red afterwards for about an hour.
Okay.
Especially just looking at your skin, your light skin with light eyes.
Yeah.
You probably get really red when you go out in the heat and all that.
Yes.
Yeah, so you'll sort of turn red and then that'll go away.
Okay.
Okay?
Sounds good.
Good.
I'm
All right.
excited.
So we just have to wait till the laser's in use right now. So as
Yeah.
soon as it's done, we'll get you back.
That sounds good.
And I'm going to start with your left side, and then I'll work to your right, okay? You're almost done with